We're going to get started on the plenary session. Welcome everybody to the first plenary of the PEGASUS conference. This is for the stream Global Health Local, and my name is Diana Ahmed, and I will be facilitating these wonderful speakers as they speak to you this morning on the topic of public health, politics, and marginalized populations. So the format of the panel will be as follows. We have 5 speakers, each of whom will speak to you approximately 12 to 15 minutes. We're going to go sequentially through everybody, and then we will save our questions and comments for the end. And at 12 minutes, I'll be giving you guys a little signal, and at 15 minutes, we'll be wrapping up just to stay on time, just because immediately after the plenary, we go straight to the symposium sessions. And then we feed you, so. One announcement I'd also like to make is this year we've been accredited for quite a few CME points through various colleges. So physicians and clinicians amongst you who wish to claim that credit need to speak with Andrea. She'll be outside the doors throughout the day. She needs to get your name so that she can send you the appropriate certification, and you can claim and submit that to your college. So just be aware of that if you do wish to get credit for attending the conference. Okay. So our first speaker, to my left, your right, is Dr. Rashid, whose face is probably familiar to anybody that lives in the GTA area through much of his work and frequent media attention. So Dr. Rashid is a medical director at the Crossroads Clinic, a medical clinic that serves newly arrived refugees in Toronto. He's also a co-founder of the Canadian Doctors for Refugee Care, an organization founded to advocate for refugees to access health insurance. He was on the steering committee of CCIRH, a group that developed evidence-based guidelines for the assessment of newly arrived immigrants and refugees, which I know many of you use and certainly we promote at the medical schools. He also co-founded the Christie Refugee Health Clinic, a clinic located in a refugee shelter. He has also brought together clinicians across Canada with an interest in refugee health through a web-based project called the Canadian Refugee Health Network and through a group called the Refugee Health Network of Southern Ontario. He was recently awarded an Award of Excellence from the College of Family Physicians of Ontario, and he's currently on staff at the Women's College Hospital in Toronto and affiliated with the Department of Family and Community Medicine at the University of Toronto.
Thank you, Diana. It is a real privilege to be here today, and as I look down this panel, it really is a privilege to be on a panel with so many people whose work I respect immensely. So I want to start, as I often do, reminding you of a story that happened not in the not so remote past here in Canada. It was in the late 1970s when there was incursions by China into the northern part of Vietnam, and in response, the Vietnamese government decided to expel all ethnic Chinese. In the confusion that ensued, many people took the opportunity to try to leave the country. And there was chaos in Cambodia and Laos at that time. Over 2 million people were moving in Southeast Asia. And although most were moving overland, the issue really came to the attention of the West when we saw pictures like this. Rickety boats in the shark-infested, pirate-infested waters of the South China Sea. The government in Canada at that time, which interestingly was a conservative government, put out a call to Canadians saying for every 1 refugee that's sponsored by a Canadian, the government was going to match it. And much to their surprise, 40,000 Southeast Asian refugees ended up being sponsored by ordinary Canadians. The government, their math being what it is, said they will sponsor 10 and were eventually shamed into taking 20. And 60,000, mostly Vietnamese, but Southeast Asian refugees arrived in Canada in the early 1980s. And I draw your attention to that because to this day, I still believe it's the best studied of all refugee migrations. Through the work of Dr. Morley Beiser, who was in British Columbia at that time, who's now in Toronto, he followed 1,500 people for 10 years. And what did he find? Well, he found that rates of employment were actually higher in the refugee population compared to people who are Canadian born. And interestingly, rates of mental health issues are lower. And although this seems counterintuitive, this is exactly what we're seeing in our practices. People need help on arrival. We know there's a high burden of subclinical illnesses. We know there are issues. But generally, when people hit the ground, they hit the ground running. And keeping them healthy, I think, really becomes the imperative for all of us. I was asked today to speak about public policy and politics, and I'm going to give you an example of what is really poorly thought out public policy, and perhaps its intersection with politics. And what I'm going to speak to you about is refugee health insurance, which was a major issue really in the last few years, mostly under the previous government. So as a bit of a background, before 2012, refugee health insurance was fairly straightforward to us as clinicians. It was run by a federal program called the Interim Federal Health Program that had been in place since 1957. There had been iterations along the way. And it covered pretty much the same thing that would be covered under provincial health insurance here in Ontario and in any other province across Canada. So you could see a physician or nurse practitioner, you could get diagnostic tests, you get laboratory tests. And it would cover a basket of supplemental services that include medications, but also emergency dental and vision care, and in some cases physiotherapy and prosthetics. And what was very important is that for us, it was provided to all refugees. So it didn't make a difference what type of refugee you were, if you're government assisted or if you're a refugee claimant. It was really the same program for everyone. And it was for urgent and essential care, although that was always interpreted very broadly. So we never had a problem, doing a pap test or screening for cervical cancer or vaccinating children. It was on a Wednesday afternoon. I still remember the announcement from, at that time, the Minister of Citizenship and Immigration, Jason Kennedy, when he announced sweeping changes to the program. And initially, the idea was that all refugees would lose access to supplemental benefits. So no access to medications, no access to emergency dental vision care. And interestingly, on the Friday before the long weekend when the cuts were to go into effect, we were watching the minister. There was a refugee conference in the U.S., and some of us watched him give an interview in the morning and didn't say anything new. And then about 4 o'clock in the afternoon, he was doing an interview with Power and Politics and just happened to mention that government-assisted refugees were never to be affected by these cuts. And around 10:30 at night, the website changed. And, fortunately, they were spared. They didn't all realize that. And there was one very well-publicized case in Hamilton of a family whose child required medications for epilepsy, and they couldn't afford the medications. The child ended up seizing, required a hospital admission as a result. Most egregious, though, was that there was a group of people that came from certain countries or sometimes had gone through the refugee determination process who had very, very limited health care. They wouldn't have health care for pregnancy, for heart attacks, for very rudimentary conditions where they covered. And what was the rationale for these cuts? Well, the government initially came out and said that it was about costs, that they were going to save $20 million a year, $100 million over 5 years. And we know now that just wasn't true. When the government was in the courts arguing for this policy, their witnesses suggested that they'd never studied it. As a matter of fact, if there was a cost savings, it was too small for them to even go through the process of researching it. That number was just taken out of the air. The minister at that time spoke about this policy being a deterrent to refugees coming to Canada, and particularly what the government determined to be bogus refugees. Now, that was a term they used quite frequently. There really isn't a formal legal definition of what it means to be a bogus refugee. But it seemed to be the common vernacular of the government when they were talking about refugee claimants in particular. For me, I think this was the critical piece that really incited a lot of us. If we want to have a discussion about whether we should be taking more refugees or less refugees, that should be out there in the public domain, and the government should speak to that. The idea of using healthcare as a deterrent for people coming to Canada, to using it really to leverage an immigration policy, I think for many of us, we found that quite odious. With time, the government landed on one argument, and that was the issue of equity. They seemed to make the argument that refugees were getting gold-plated health care better than ordinary Canadians. It was an argument that certainly stuck. They repeated it incessantly. The problem was it just wasn't true, that the health care they were getting was identical to what low-income Canadians were getting in Canada. And I think more and more we realized that that policy was really about political capital, that they had likely some polling data showing showing that it would play well amongst their base. It really was a policy that I think many of us argued was unjust, but it was also very impractical. It was difficult to understand. There were certainly many of us who felt that there were cost implications to rolling this out, and I think it was just really bad politics that drove this. So I should mention that I've done many talks trying to explain those cuts to healthcare workers in hospitals and community health centers. I think there was very few of us across the country that actually understood the policy. I mean, I would see blank faces looking at me a bit starry-eyed and things. It was very complicated. The cuts were really based on where you came from, what type of refugee you were, where you were in the refugee determination process, and even sometimes on the diagnosis. So, you'd have to know what someone had before they came to see you to know if they were covered. And as you can imagine, for a lot of healthcare workers, they just stopped accepting IFH, and more we were seeing refugees who were covered who were being turned away. So what should be the response? Well, I sent out an email to some colleagues that Wednesday when we heard, and we were still putting the details on these cuts. And the next day was a Thursday. I remember this because I was in the shelter where I work on Thursdays, and I got a call from someone some of you might know, Dr. Phil Berger, who's a family doctor at St. Michael's Hospital, did a lot of work around HIV in the early 80s when it wasn't so fashionable for family doctors to see people with HIV. And I didn't know him well, but he called me and he said, listen, this is horrendous. I said, yes, it's horrendous. And he said, I've got an idea. And I said, great, what's the idea? And he said, well, it worked in the 1970s. I thought, okay, that's great, well before the internet. He said, here's what we're going to do. We're going to go occupy a federal government building. I said, who is this? Well past the comfort zone for many of us physicians. But the more I thought about it, the more I realized the government had made this announcement. It sort of flew under the radar. There were going to be serious consequences. And we felt very strongly if we could put that issue out there in the public domain, that many people would be would object to this. So we tried to get 12 doctors to go into the office of Joe Oliver, the highest ranking Conservative member of Parliament in Toronto, and we actually ended up with 90. It actually became difficult to coordinate because we didn't tell anyone where they were going until about an hour before. It was chaos, but we didn't want them to lock the door if we were coming. And we had 90 people in there. We had relatively good press. Most of the local press picked it up, even some international press. A couple of days before, we put out a call to colleagues across the country. And, within 2 or 3 days, there was a protest in Ottawa and Hamilton, Kitchener, Winnipeg, St. John's. So very quickly, our colleagues were able to get together and allow us to state very clearly that there had certainly been people across the country who took objection to this. And when we left, we thought, okay, what do we do now? There seemed to be a momentum across the country. There were people doing really good work. And we put together a day of action that many of you, I think, might have been at, where we had, I think the first year, we had 21 cities across the country, including places like Iqaluit and Victoria, St. John's, to protest these cuts. And then Philip had another idea. And I got to say, I was not big on this. I'm going to show you the video if you can put that up. So I've got to tell you that I disagreed with Philip about 2 or 3 times over the few years we were working on this one issue, and I was always wrong. I wouldn't say that if he was here, of course, but I was always wrong.
Help medical facilities like Toronto General, patients across Canada, and the field of medical imaging worldwide.
Minister Oliver, doctors in this country will not remain silent in the face of the Conservative.
Well, I'll answer those questions after my announcement.
To the refugee health program.
I will be very happy to answer those questions after.
Of the most vulnerable members of our society, refugees who are coming from war-torn countries, fleeing hatred, fleeing crimes against humanity, and your government is about to cut the very essential medicines and very essential services that these people require in order to continue living. This is not the legacy of Canada. This is not the kind of country that we want to live in. I am not alone. We have medical associations across this country, the CMA, the OMA. All of these organizations are denouncing your government's cuts to the interim federal health program. What do you have to say for yourself?
Perhaps we could give the minister the courtesy of finishing his remarks, and I'm sure
the minister will be disrupted from this point on. Members of the Conservative government will be disrupted from this point on by Canadian doctors across this country.
Do you want an answer to your question?
Please do.
Okay. The answer to the question is that our government believes, as most Canadians believe, that all Canadians should be given the same health care. And we do not believe that people who just arrived, recent refugees, should be given superior health care to that of Canadian residents and Canadian citizens. We are equalizing the health care so that everyone in this country is treated equally.
Minister, you well know that there are folks on Ontario Works who receive very similar benefits as refugees coming to this country. Refugees are coming
Well,
to this country.
I've answered the question.
You are cutting off maternal benefits. A pregnant woman will not be able to get health care because of you. A pregnant woman. A diabetic will not be able to get insulin. Will come into my emergency department with diabetic ketoacidosis. Okay, do you think that's going to save money for this country?
This is an important announcement for Canadian patients
I understand.
who require. No, you are interrupting, and I'm rather embarrassed on behalf of our hospital that we have a representative of the Canadian people here who's unable to announce something that's very important for Canadian patients. I'd ask you, doctor, if you are a doctor, please take your seat and please show the minister the courtesy that.
I don't believe this minister deserves my courtesy, or the courtesy of any doctor in this country.
For Canadian patients, you've ruined this announcement. Thank you.
For Canadian refugees.
So I'm going to stop it there. It does go on, and it's worth looking at. Faria Kamal was a medical student, was also involved in that. And I thought this was a really bad idea. Every time I see someone shouting down politicians, I just think, oh, what a jerk. And Philip said, yeah, that's true, but they're not wearing lab coats. And he was absolutely right. After this, 100,000 hits on YouTube, I think within a couple of days, they were both getting marriage proposals. The head of the Canadian Medical Association actually got in touch with Dr. Kiefer and Dr. Kamal and asked them if he could support them in any way. And editorials followed. So we had, I think, about 13 of those actions where people were shouted down, and universally the media around it was positive. This was an article in The Guardian after that first event in Joe Oliver's office. I think people just aren't used to physicians out there protesting for things outside of our own self-interest in many ways, and it did really gain a lot of traction. Also, there was a number of national organizations that came on board, including the Canadian Medical Association, the College of Family Physicians, Canadian Nurses Association, groups representing midwives, pharmacists, optometrists, social workers. If you're a healthcare worker in this country, there's a very good chance your national organization came out with a public statement denouncing these cuts. The government's response tended to be mean-spirited and sarcastic. When we mentioned the lawsuit that was filed by the Canadian Association of Refugee Lawyers, of which we were one of the litigants, the response of the minister at that time is, this is the work of a small group of militant leftists, which really upset us. And so we had a meeting the next day, and we really thought we were going to get to the bottom of this. The College of Family Physicians had a great line. It says it does not consider itself a hardcore pressure or left-wing militant organization. So tongue-in-cheek. And in 2014, the Federal Court of Canada, known, I'm told, to be a fairly conservative court, came out with a scathing decision that asked the government to rescind these cuts, basically suggesting that that program was a violation of the Canadian Charter of Rights and Freedoms. The government had a few months to rescind it. They waited until the last day. They did rescind the program and rolled out another program that had many elements of the cuts embedded in it. Again, mean-spirited, I think. Why did the cuts elicit such a response? I think, for many of us, the policy was so flawed. I mean, not only was it inhumane, but it was so complicated, no one understood. And I think a 10-year-old could look at this and say, that's not good public policy. It's just not going to work, and it didn't. I'd like to think the Canadians take exception to us targeting the most vulnerable, and certainly we saw quite a response from not only healthcare workers, but really faith-based groups, artists, and a lot of Canadians across the country. There was tremendous leadership. I mentioned the national healthcare organizations. There are people across the country, clinicians and non-clinicians, who did tremendous work. Rithika, Dr. Philip Berger. I mean, there were just some really amazing people who stood out in this issue. And I think the idea of connecting health and immigration, using healthcare as a leverage to shape an immigration policy, is something that many people found offensive. We had people who were self-defined as supporters of the Conservative government who came out publicly and opposed these cuts. I think it just didn't really make a lot of sense. So sunny days right now. Within a few days of the Liberal government coming to power, they made a statement saying they were going to fully restore the cuts. And in April 1st, they did rescind the program, and we're back to where we were before 2012. Issues still remain for refugees. I mean, we've seen a lot of media around detention from refugees. We're having a really hard time in our clinic with people who've left family behind, particularly mothers who are separated from their children, and the 2 or 3 years it takes sometimes to reunite them. So certainly there are a lot of issues on the agenda, but it really does feel like a different time with that government no longer there. So people ask what was effective. As we look back, I mean, no illusions. We have no doubt that the Conservative government was not going to rescind this program, and it really was a change in government that ended up causing the program to be restored. But I think for us, what worked in keeping this issue alive was building broad coalitions. I mean, we had good connections with the Canadian Medical Association, the college, the OMA. We focused on one issue, and sometimes we were criticized for that. There were a lot of things happening in terms of refugee processing, and much of the energy of the Canadian Doctors for Refugee Care, at least, was focused on the one issue of the refugee health cuts. And what that did allow us to do was to keep a very broad coalition. We maintained accuracy about claims. Many times people would call us and tell us about a patient that was affected. We'd have students that would go and speak to the lawyers, make sure that what we were hearing was accurate before we put anything out in the public domain. We had national representation. Again, there were great people across the country. And I really don't think we would have been able to do much 10 years ago. I think the world of refugee health has really changed in the last 10 years. I think it began with the migration of the Burmese, where many of us didn't know what other people were doing, even as far as Hamilton or Ottawa. And certainly relationships were built around that. The work that Kevin Potty did with the national guidelines brought together people across the country. The Refugee Health Conference, I think, has helped to do that. So at this point in time, we were able to build those networks very easily, which I think would have been a real challenge even 5-6 years ago. I'm going to leave you with this quote from Elie Wiesel, a survivor of the Nazi concentration camps and a Nobel laureate for literature. Today, as yesterday, a nation is judged by its attitude towards refugees. Thank you.